Today I would like to speak to you about the budget of this year 2025 and what it holds for our healthcare in India. First of all, I would like to begin by thanking the organizers of BW Healthcare Excellence Summit 2024-25, especially Mr. Anurag Batra, Mr. Arvind Narula, and their entire team of BW Healthcare World for the honor of inviting me here to chair the BW Healthcare Excellence Awards and to deliver the keynote address at this esteemed gathering. One second, please. This summit comes at a crucial time as the Union Budget 2025 was announced exactly a week ago. Therefore, I thought that for my address today, we can delve on the implications of the recent budget announcements and at what it holds for the Indian healthcare. The Union Budget is more than just a financial statement. It is a reflection of the government's priorities, a roadmap that signals where the nation is headed. Each budget tells a story, revealing the areas that demand urgent attention and the sectors that are seen as engines of growth. History has shown that nations that invest in health build stronger, more resilient economies. A health population is not just a social imperative, but an economic one, driving productivity, reducing long-term healthcare costs, and ensuring sustainable development. As India aspires to become the third largest economy with a $5 trillion GDP, it is heartening to see that the government recognized healthcare as one of the 6 pillars of Viksit Bharat. The government healthcare spending in India has witnessed a regular and an incremental rise in the last decade. But in spite of this, India's public health spend is amongst the lowest in the world. In 2018, the government announced that it will spend 2.5% of its GDP on health by this year. But the recently released economic survey reveals that the government spending on health, combined spending by the central and the state governments in FY 24-25 is around 6 lakh crore rupees, which is only 1.8% of the GDP and not 2.5%. This figure is important for you to remember that America spends anything between 16 to 18% on its health budget. UK spends about 8 to 10%. And here we are still hovering below 2%. And the government itself has said that we would like to spend minimum 2.5%, which has never happened before. On top of that, the public health expenditure includes allocation to health and family welfare, health research, Ayush, water supply, and sanitation. No one can deny that spending on clean water does keep the population healthy. But it is not a substitute for spending on public health systems. If you remove the spending on water and sanitation from the health budget, you will find that the expenditure on healthcare has been stagnant or even on a decline if adjusted to inflation. Going by the government's own commitment of spending 2.5% of GDP by the end of this year, total public health spend has to reach at least 9 lakh crores. Out of this, center has to spend 15% or 1.35 lakh crores, and the states about 85%, which is 7.65 lakh crores. But the actual allocation by the center for FY 25-26 is only to the tune of 1 lakh crore, which indicates a shortfall of at least 35%. And going by the spending, the states will also spend to the tune of 6 lakh crores, again failing to reach the 2.5% of GDP. The budgetary allocations to the Ministry of Health reveal a deeper push for number one, accelerating digital transformation in healthcare, with 50% increase in the National Digital Health Mission or NDHM. Number two, strengthening public health infrastructure with allocation to to the PM Abhim, that is Ayushman Bharat Health Infrastructure Mission, being increased by 40%, and continued focus on public health insurance under ABPMJ, that is Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, with a 25% increase in the budgetary allocation. To my mind, a major shortfall in budgetary allocation this year is a meager 3% increase in the National Health Mission, or NHM, which in real terms, when adjusted for inflation, is actually a decline in allocation compared to last year. NHM is extremely crucial as it funds primary health, including health and wellness centers, or HWCs, which are a pillar of the foundation of our healthcare, or Ayushman Arogya Mandirs, as well as national programs for NCDs, or non-communicable diseases, and several other communicable diseases also. At this point, I would like to remind you all that NCDs, or lifestyle diseases, account for nearly 65% of mortalities in India and lead to an annual GDP loss of about 2% due to premature deaths and high morbidity. We have been working with over 100 health and wellness centers in the states of UP and Uttarakhand, initially through our own personal philanthropic initiative known as ALVL, or Arvind Lal Vandra Lal Foundation, and now through an industry coalition led by FICCI with Nat Health and OMAG. And from this experience of more than 3 years, I can vouch that there is a dire need for increasing the spend on primary healthcare substantially to strengthen the infrastructure, fill up the HR vacancies, maintain availability of drugs and diagnostics, improving mass-scale screening for common NCDs, and to enable adoption of digital health solutions like EHR and telemedicine. Investing in these areas will be pivotal in improving health outcomes and reducing the burden of our secondary and tertiary care facilities. In the absence of reliable primary health care services, our tertiary care facilities, like existing in All India Institute, etc., have to bear a very high OPD load of patients with common ailments that can easily be managed at primary health care facilities. Access to an MBBS doctor or doctors at all PHCs, along with basic diagnostics and drugs, can act as an effective gatekeeper for the secondary and tertiary hospitals, which will ultimately be cost effective as well. To ensure universal healthcare access, we will have to strengthen the primary and secondary healthcare facilities in the initial point of contact for patients, that is the HWCs and the CHCs, the community health centers. The government's announcement to establish cancer day care centers in all districts or district hospitals over the next 3 years, starting with 200 centers in the next FY, is a well-founded move towards decentralizing cancer care. Additionally, the customs duty exemption for 36 lifestyle or life-saving drugs for cancer, rare diseases, and other chronic illnesses will improve affordability and patient outcomes. However, early detection is equally critical. We need policy measures to encourage tech-enabled mass screening solutions and customs duty reductions on diagnostic tests or diagnostic test kits and reagents. During the COVID pandemic, the entire world accepted the test, track, and treat strategy, recognizing testing as the first crucial step to control the pandemic or any endemic for that matter. The strategy holds true for all communicable and non-communicable diseases also. Unless we test, how can we control a disease? A study by Public Health Foundation of India, or PHFI, estimated that early detection of diabetes and hypertension could reduce lifetime treatment costs by up to 30 to 40%. Similarly, WHO estimates that every dollar invested in scaling up early intervention for NCDs can yield 7 times in economic returns over time. And in other words, this is a very strong economic case for investing in primary health care. As they say, better late than never. We must prioritize primary health now. For services beyond primary health care, there is the Pradhan Mantri Jan Arogya Yojana, with hospitalization cover of 5 lakh rupees for more than 10.7 crore vulnerable families, that is about 50 crore population or beneficiaries. This year, a good thing that has happened is that the scheme has been further extended to approximately 6 crore senior citizens over the age of 70 years and 1 crore gig workers or the delivery boys. As the coverage of PMJ has been extended, the government must also think on lines of expanding the network of empaneled hospitals, especially to include large, credible private hospitals. Most of these hospitals have stayed away from PMJ due to unviable reimbursement rates that fail to even cover the cost of the procedure. In 2018, under my chairmanship, FICCI conducted a scientific costing study across 9 hospitals, including 2 public hospitals like AIIMS and ILBS, for 10 common procedures. What we found was that for all the 10 procedures, PMJ reimbursement rates were lower than the actual cost of even performing the procedure. The government needs to work with the private sector to arrive at an agreeable reimbursement rate or rates based on scientific costing methodologies, along with implementing a differential pricing model pretty much like the Indian Railways, what they charge. You travel in unreserved second class or reserved second class or AC chair car, you pay different rates, so the train is going from point A to point B. And that is what we are saying, that these are differential rates which should be charged also in healthcare. And this will incentivize hospitals for quality care and investment in talent, technology, and scale. Another significant announcement was related to expansion of medical education. The government has increased undergraduate and postgraduate seats or medical seats by 130% over the last 10 years. Now nearly having 1.1 lakh medical seats. In the next year, 10,000 additional seats will be added in medical colleges and hospitals towards the goal of adding 75,000 seats in the next 5 years. On the other hand, the Economic Survey 2024 and 25, released a day before the budget announcement, highlighted the concerns that affect the quality of training, like shortage of faculty, ghost faculty. You have teachers who are non-existent. Low paid, and this is medical colleges, not in schools and colleges, medical colleges I'm talking about. Low patient load in hospitals, lack of infrastructure, etc. Therefore, the true impact of increasing number of medical education seats depends on parallel investments in faculty, infrastructure, and clinical training quality. In conclusion, I would like to say that we need bolder investments in primary care, diagnostics, medical education, and health infrastructure. Public and private sector collaboration will be key in shaping a resilient, inclusive, and innovation-driven healthcare ecosystem. The former president of the US, Joe Biden, has frequently used a phrase to emphasize that a government's budget is a direct reflection of its priorities and commitments. He said, and I quote, "Don't tell me what you value. Show me your budget and I will tell you what you value." As we strive for a Viksit Bharat, let us recognize that investing in healthcare is investing in India's future, because only a healthier India is a prosperous India. Thank you very much.